Hi, let's talk about heart failure today. So there are several types of heart failure, but the idea is that the heart is unable to maintain adequate perfusion of the tissues. So this is referred to, the perfusion is essentially the blood pressure. If you can't adequately apply enough blood pressure at the capillaries, the tissues just don't get the blood flow through the capillaries, and there's a lack of perfusion, a lack of oxygen that's delivered, and the tissues suffer. So when talking about blood pressure, and in particular when talking about CPR and you're doing chest compressions, the goal of the chest compressions is to essentially pressurize the blood in the arteries. So you're artificially compressing the heart and causing the perfusion pressure to increase so that the blood can flow through the blood vessels and perfuse the tissues. So in heart failure, the heart's diseased and it's not pumping as well as it should. It's become weakened. And there are numerous causes. You should probably pay attention to some of the main risk factors for heart failure, such as hypertension or high blood pressure. Either side of the heart can fail first. They typically wind up both failing eventually, but sometimes the left side fails first, sometimes the right side fails first. And when one side fails and the other side continues to pump adequately, it results in fluid shifting between compartments. And we talked about fluid compartments early on. And the two fluid compartments, well, the fluid compartment that we're talking about primarily is the interstitial fluid. So fluid shifts out of the blood into the ISF, and we can wind up with swelling. So now if the left side of the heart fails, think about where the left side of the heart is pumping. It's pumping out to the systemic circulation. So if that side fails and the right side is still pumping normally, where is the right side pumping to? It's pumping blood into the pulmonary circuit. So the right side continues to pump blood into the lungs, but the left side can't move it on. So it backs up in the lungs with left-sided heart failure, and we wind up with fluid leaking out of the capillaries and into the interstitial spaces of the lungs, and we have pulmonary edema, fluid in the lungs, left side. So make sure you can kind of think that through. So if one side fails and the other side is adequately pumping, the failing side can't move it along, so it backs up. That's the idea. So that's left-sided heart failure. You tend to hear or detect fluid in the lungs. With right side heart failure, the right side is failing. It's unable to push adequate blood into the lungs. It can't keep it moving along. So the left side is still pumping, and the left side is pumping blood throughout the systemic circulation down to the lower extremities, and then it needs to move back. But if the right side of the heart is not moving it on to the lungs, then the fluid backs up, and it backs up down here. And we wind up with peripheral edema. And that typically shows up at the lowest portion or lowest point on the body because you are fighting gravity to return blood to the heart. So it tends to back up, pool in the feet, and what the patient usually presents with is swollen ankles, swollen feet, lower legs. So somebody with right side heart failure, classic sign is swollen lower extremities. Okay, so play around with that, right side, left side, where the fluids shift. And this slide is looking at how you describe heart failure, or how you sort of describe it quantitatively. So if a patient has heart failure, one of the first questions that a physician is likely to ask is, what is the ejection fraction? That's going to describe how diseased the heart is, what the degree of failure is in the heart. It's pretty straightforward. So the idea is, how much of the end diastolic volume can the heart move? What is the percentage? So it's pretty straightforward. It's the end diastolic volume. It's the percent of the end diastolic volume that's ejected. And the ejected portion is the stroke volume. And all you're doing is trying to figure out what's the percentage. So it's the amount of blood that is ejected over the total, times 100. So a typical ejection fraction is around 50 to 65% in a healthy heart. So you should probably remember this, just so you have a ballpark idea. A little over half of the blood that enters the ventricle is ejected. So 65% of the blood is ejected at the upper end. About half the blood, that's 50% of the blood, is ejected. So let's consider this problem, and we'll work an example. So given these two numbers, end diastolic volume and the end systolic volume, calculate the stroke volume. Well, we've done that before, so let's just do it again together. Stroke volume is EDV minus ESV. So that is equal to 135 minus 80. And that gives us a difference of 55 mils per beat. That's the stroke volume. Okay, so stroke volume equals 55 mils. It's implied that it's one beat for each stroke of the heart. So the ejection fraction we have is stroke volume over the total. And the stroke volume is 55 mils over 135 mils times 100, and you should calculate 40.7 what? Percent. So just a little over 40% of the blood in the ventricles is ejected. That means that 60% of the blood is left in the ventricles and was not ejected. So that gives you an idea of how to calculate the ejection fraction and then evaluate it. Is this normal or not? With an ejection fraction of close to 41%. And you say, well, no, it's low. If this is our normal range of 50 to 65, we're a good deal below 50. So I hope that helps. Practice it. Make up some numbers. and do this till you kind of understand it and you have a few things memorized, such as a formula and the simple math. And then plugging numbers in is pretty straightforward. Okay, that's all.